you, your medicines, your illnesses, et cetera, et cetera. In other words, your little bio is going to be shared by everybody, and that's terrific. They should have done that long ago. Because the redundancies that exist in the medical profession are outrageous.
Sure.
Unfortunately, I had a very terrible accident, so I've been a lot in hospitals and rehabilitation. I was in one on a rehab where they were going to do x-rays. I said, oh, I had them done at the hospital. Oh no, we have to do them again. We're making a big fuss about it. I said, I'm not doing those x-rays again. You have them done, go check it out. But I had to stand up for that. I mean, I could have said, sure, just take them over again. What's the difference? But in any event, so the duplication that exists in the medical profession adds a lot, not only to the duplication in the costs, but all the referrals and unneeded tests, et cetera, et cetera, et cetera. We have to look very carefully at that.
Well, I think when you talk about that, actually the subcommittee I chair in VA, we're talking about cost savings in electronic medical records.
Exactly.
And the VA is trying to move towards that process. And they're getting there slowly. I think they're going to be able to manage it. We have a backlog of over 800,000 claims from presumptives from Agent Orange in Vietnam.
Right.
These men and women are sitting there trying to file their claims, and I've been in the stacks of papers of this high.
I believe it.
And you have people that specialize, like you're saying, like you go for an exam. Well, there's claims adjusters that specialize in each of these. Well, that file can only be on one person's desk at a time.
Exactly.
If that file is digital, not a computer system, they can look at the parts they need to simultaneously and execute that quickly.
Exactly. And now
when you come back to the sharing, I actually had the discussion with the general the other day. Think about every time a soldier's deployed, a soldier comes back, he has a physical. There's a record at the DOD with that. That record, to this day, still is not transferred from the VA when they leave the military. They have a medical history there. They're working on it. The other issue you run into there, and I think the private industry has a little bit better because unfortunately, they're behind the ball on it a little more. But how do we get the systems to talk to each other?
Right, exactly.
So we're going through that whole process.
Right, and I know you guys are working really hard. I don't know whether we're really aware of how much you go through to bring a better America to us all.
Suzanne next. Suzanne, it's time to wrap it up.
Okay, I am. I'm going to wrap it up on a happy note. I'm a capitalist. And I've always thought of internationally. So whenever I bought something, I bought it for the value and the dollar, like my cars. And Brian, you should know that because we talked about yesterday. I just bought a new car. And what triggered it was a sign in the Ford window that says we didn't get any tax dollars. We manufactured it right here in the United States. And you know what? That made my decision to buy the Ford. That's it for me.
Thank you very much.
We'll hit the outlines, and then we'll go back to the tables.
Good afternoon. I'm troubled. You voted for the Ryan budget, which radically would change Medicare as we know it. You're also talking about a real deep interest in changing Medicare, that the VA is able to negotiate for good prices. Medicare is not, and that's something you'd like to change. So my question is, why would you vote for a budget bill that would radically change the most efficient healthcare delivery that we have in this country and not try to change it? And I guess my follow-up to that is the Bush tax cuts didn't create jobs. And you're calling for a continuation of unbridled, here and there and everywhere on the part of corporate America. You look at Verizon. In the last 2 years, Verizon got $1.3 billion in rebates, tax rebates. They didn't pay taxes. And we need to stop.
That's why we need tax reform.
What we need is a traffic cop for corporate America and the wealthiest Americans.
Tax reform. Telling you it's tax reform.
We need to close loopholes and make corporations.
Well,
and
obviously
the
you
wealthiest
walked in late
Americans.
because I've said that about 5 times.
I think
I
that
think tax reform is the key to job creation. I believe that.
I think that what I've heard is otherwise, and I think we need
Are
to
you
strengthen.
listening to the words out of my mouth and not listening to the rhetoric of everybody else? I'm telling you what I believe is the solution to the problem.
Well, I'm here.
And I think that is part of the problem, that we've gotten into this polarized discussion that I get the label of something everybody else says. You know, when I tell you something that comes out of my mouth, that's what I believe, that's how I am. I'm not someone else.
And I've heard you say you voted for the Ryan budget bill, and at the same
Yes, I
time that
did.
you want to fix Medicare. Fixing Medicare.
Medicare is broken, do you agree?
I think that Medicare needs to be strengthened.
Medicare is broken, do you agree?
I think that Medicare needs to be strengthened.
Can you look at that chart and tell me Medicare is not broken?
I think that Medicare needs to be strengthened in order for it to survive, and that's through
How would you
innovation.
define strength?
By making corporations pay their fair share, the wealthiest Americans.
I've already agreed to tax reform. You're talking in
You're
circles.
talking about tax cuts for
I'm
businesses.
talking about tax reform.
Well, we need to reform our tax system so that the wealthiest Americans and corporations will pay their fair share. And I'll stop there. I'm with New Jersey Citizen Action.
Congressman, again, thank you for coming out here. I have a couple of questions, and as a quick background, I work in a medical line. So I am a healthcare provider. Even if we don't interact directly with patients too often. I mean, how many people here, when you go to the doctor, how many doctor blood tests? How many people here?
Blood test.
Blood tests, sorry. Yeah, right. How many people here, I know the population, so, are on Coumadin or something here?
Blood test.
Blood tests, sorry. Yeah, right. How many people here, I know the population, so, are on Coumadin or something like that, that has to be monitored regularly? Now, the issue that I want to bring up, and it does directly, it's a question for you, is directly impacts our senior population. Medicare. Medicare is currently trying to impose on laboratories the requirement that we bill the 20% copay to the subscriber, to our seniors. Currently, laboratory testing is exempt. We don't have to bill, and we do not bill 20% that Medicare doesn't pay. We just write it off. What CMS, HHS, Medicare in Washington is trying to do is they're trying to impose regulation on us that we must start collecting from seniors at 20%. Of course,
Would you, first of all, would
Yes.
you agree if that ever happened, there would be less seniors going to get their test done?
no,
You wouldn't?
no.
You wouldn't think they would forego the test to save the 20% out of their pocket?
Well, the issue is this. Very often, that 20% is going to be $2 or less. But the issue is, for the labs that do serve our population, especially homebound nursing home populations, they don't get a choice anyway. The doctor orders a test, and it gets done. The issue is, and what we're asking is, my question is, would you be willing to support laboratories push to not have to bill literally 100 million bills a year for $2.
I think when you look at it
Right.
from a business aspect, that's one of those regulations. Those
Absolutely.
regulations that you're putting on the industry.
Absolutely.
Can you swallow that? Now you're talking about adding a whole nother section of your accounting department, all the paperwork, the paper, the postage, all this kind of stuff. It's another layer of regulation you've added to the process.
Just as an example that I just gave you, your Coumadin bond, right? Your anticoagulants, your PTI and R test. How many people here get that done? Medicare pays us less than $5 for it. You would have to put a 44-cent stamp to collect 80 cents. That gentleman over there, he would have to put a 44-cent stamp on it to mail us the check for 80 cents. And right now, we're willing to just say, okay, well, you don't want to pay us the 80 cents. That's fine, it's a savings for the government, it's a savings for the senior citizen. Would you be willing to support that? We are making a push for it. And not put that very cumbersome process on us and our seniors.
Yeah, because I agree with you, like you're saying, it's a bad business model. It's going to force labs out of business. It's another strain on the senior who is already on a fixed income.
Right.
There has to be a way to go through this, and we've talked about it. We've talked about reducing the cost of medical care. That's an obvious example of it. I know we go through we keep going through the doc fix every year. Doctors keep cutting their reimbursement. It's the same thing, kind of the same model you're talking about. And it's this whole process of, who are we going to take it away from? At some point, everybody, care isn't going to be there because people are going to walk away from the table like, I can't afford to do it anymore. And we're not addressing the problem, which is the cost. We're just pushing the cost around to other people.
We're already going to, as an industry, we're going to have to take a 20% cut in the next 5 years. We're just going to. It's already in the rules, it's already in the legislation. We're going to take it on. By the way, if anybody's interested, laboratory, you guys go get your lab work, your blood work done, and all that stuff. It's involved in 70% of medical decisions, but it uses only 3% of the healthcare money. For every $100 that gets spent on healthcare, only 3% goes to lab testing, but it involves 70 to 80% of the decisions in healthcare. So we're already low. You're going to take 20% from us, fine. Everybody has to, everybody has to take a cut. Except for the doctors, probably. They're not going to take the 20%. But, so, again, what we're asking is that we support our industry push to not have to build this 20% for the senior city.
You can't afford it, they can't afford it.
Well,
We have to find a solution.
it's going to cost us $5 to collect 80 cents.